Well, it's been 100 days since South Africa recorded its first COVID-19 infection. Since then, the country has surged and the number has surged to 58,568 confirmed cases, with 1,210 deaths. Over 33,000 people have recovered, though. The economy has also taken severe knock because of the lockdown, and Health Minister Zweli Mkhize joins me now live from our Durban studio to reflect on the past 100 days. Minister, thanks for your time. We appreciate it. So it has been 100 days since we recorded our first infection. Honestly, how are we doing?
Well, I think we have a very difficult, task at our hands. The infection is growing. We did anticipate that it will grow. Our main issue was whether we could delay the infection so that it doesn't rise so fast as to overwhelm our institutions, our hospitals. At the moment, we're holding on. We have not been overwhelmed, and we have not really got a shortage of beds or ventilators or ICU beds. And we are therefore, we have used the time to prepare to increase the numbers of beds, field hospital beds, as well as increase the staffing and also align the strategies of managing the problem. So over the past 100 days, I would say we have held on pretty well. With the lockdown, we were able to defer or deflate the curve in such a way that we didn't immediately get overwhelmed by large numbers. Now, that would have happened if we had not done the lockdown because of the rate at which the infections were rising. So I would say that we are now facing a next challenge, which is to deal with the day-to-day flattening of the curve as the internal transmission has taken root. It's something that we have to deal with on a day-to-day basis. There can never be any letting off our foot off the pedal.
Yeah, so you talk about delaying that infection rate, but the reality is, Minister, that we're now seeing those cases increase dramatically overnight. What else can we do to actually try to make sure that we don't see such huge increases? Is there anything we can do?
Well, to start off with, let us look at what happened. For the 8 provinces in the country, we were able to actually keep a very low growth rate in the infection, but we did have an outbreak in the Western Cape, which came from a number of cluster outbreaks. That is what is driving the numbers up, as well as you can see that 2/3 of all the infections are actually happening in the Western Cape. Now, what we are seeing is that the numbers are going to increase because we are now reopening the economy and social activities, so that will inevitably give our numbers to rise. That's why it's important to go back to the message that the most successful strategy to deal with the infection is the issue of wearing of masks, social distancing, hand washing, sanitizers, and make sure that everyone takes responsibility as an individual to prevent the spread of the infection to others or to themselves. And this is why I think we need to focus as a country, because we will not be able to get rid of the COVID-19 within a few months. It might take a year, 2 years or more. And so in returning to normality, we must know that we have to change our behavior. So the extent to which we will succeed as South Africans, it will be on the basis to which we are prepared to change our behavior. All the countries that have succeeded to contain the numbers were able to change their behavior.
So, Minister, talking about changing behavior, we know that alcohol changes behavior quite dramatically. You have calls from the Eastern Cape for alcohol sales to be banned. You have Gauteng thinking about it as well, because we've seen the pressure it's put on hospitals. What's your thoughts on it?
Well, my thoughts is that it's very difficult to stop people from drinking alcohol. However, we have noticed that in the absence of alcohol, we had empty casualties, very low numbers of trauma, people who have died of unnatural deaths, people killing each other, shooting at each other. stabbing each other, motor vehicle accidents, casualty wards were open, they were not overwhelmed, our theaters were not too busy, our ICUs were not too busy. Now that's a very enviable situation if we're to keep to that. So the point though is that when people go out and start challenging government, that government can't stop them from drinking, then it becomes very difficult to manage the situation. If there was a way of getting people to understand how destructive the abuse of alcohol is to our health system, they would really be very helpful to get people to understand that we need more of our spaces so that our wards, our beds, our ICUs are not overwhelmed. So our view really is that we would like to appeal to society in general to know that a restraint in the abuse of alcohol has got a lot of advantages for our society.
So will you, as the National Coronavirus Council, actually consider that, though, the rebanning on the sale of alcohol? Because that's what some provinces are actually saying that they're going to put forward to the council.
Well, we have to always consult, provinces, provincial governments, as well as various society stakeholders. This doesn't become a very simple matter. However, there may well even arise a situation where we might feel that the numbers of beds are compromised by the fact that there's too much of trauma, and that the record that we've got is indicating that there has been a lot of relief when the alcohol was not being easily available. We might have to consider it, but at the moment we really go by what the latest discussions and consultations take us through. But obviously the issue is about persuading the public and indicating to them that there is a need for us to restrain ourselves, because some of the habits that we like so much do actually have a negative impact in the spread of the infection, even as to loosen the possibilities of people being able to look after themselves. They can easily spread infection under influence. They can easily get the infection under influence. It is a matter that people must always keep in mind.
So there's obviously been over 100 COVID-19 infections at school in week 1 of pupils going back. There are SGBs calling for schools to be shut down again, because this, of course, will have an implication and directly on pupils themselves. What do you say to that?
I think that the first thing we must accept is that after a month, after 2 months, after 6 months, after 1 year, maybe up to another year, we'll still be having COVID-19 to deal with. Are people saying we should close the schools for the next 2 years, if that's what it takes? I don't think so. I think what people are saying is that they're anxious, that the implications of opening the school may not be well known. And from that point of view, all we say, let's work together. Let's try and see how distancing and masks can assist us to be able to reduce the rate of the infection and keep our children safe while they go to school. Now, if we can balance it from that point of view, I've seen different countries where they've actually used the distancing as the most effective way of controlling the infection. It can happen, it can be done. Can we work together and look at that rather than fighting amongst each other, when in fact we've got a much more formidable enemy across to face?
Yeah. Now, many South Africans are already asking this question, but given our high numbers right now, when do you think we'd actually get to level 2 of this lockdown?
Well, the numbers are going to will never ever go down again. If we say we are at 50,000, even if we get to 60,000, you'll never get to a situation where you are now back at 20,000 or at 10,000. So we need to understand that we have to adjust now. We have to adjust to the fact that the infection is going to increase. We have to adjust to the fact that the numbers of people who succumb to the infection will increase. We have to adjust to the fact that we're going to try and create a normal social and economic life of our country in the midst of a raging pandemic, and we have to find a way to survive. And therefore, the schools will open, but we'll need to, if they close, we'll understand that. We'll have to correct whatever can be corrected, strengthen what needs to be strengthened, and get them back to normal. If the mines, we find some people who are positive, we have to do the same, test them and then screen those, and then try and correct what needs to be corrected, try and reopen again. We've already done that in the Western Cape. We had retail chain stores that had people were infected, and they had to be closed. We had to quarantine people, reopen the shop, go back. If it becomes a problem, you close it again, you move on. We are going to be having that type of uncertain a future as we try to battle with the infection. It's important to say that fighting COVID-19 and also trying to flatten the curve is going to call for each and every sector of society and economy to know that they've got a role to play. It's also going to mean that all of us might wake up today and find that there's a situation that requires immediate attention. We have to attend to that, but we can't go back. The economy has to be reactivated. Social life has to be kind of normalized under new circumstances. We have to, just try and make it work. But there isn't such a thing as to say, why is government opening? Because there's not going to be a time when we'll have fewer infections than there are now.
Yeah, I'm not saying that. Very quickly, Minister, do you reckon, though, that we'll get into level 2 next month or the month after?
I think that, we can get to level 2 in a matter of a week or 2 weeks. It's really a matter of adjusting. As we adjust further and further, it should be, possible to get to those levels. But I think some of the areas that might require, that might be able to do that, might be areas which we have called the low transmission areas. These low transmission areas are areas where the numbers of people who are positive is low, and we have encouraged that our system must detect those who are positive and try and quarantine them, isolate them, so that you don't increase the numbers very fast. So there has to be, areas that must go back to level 2 and level 1. That should be natural. The question is, how do we deal with the hotspots where the numbers are increasing very fast?
And lastly, and I think very important, you've just come back from the Eastern Cape, you've been across the country. Has anyone even asked you, how are you doing?
Well, people ask me how I'm doing, but I also ask how they are doing, because we're all battling the same challenge. And I think what's important is to say that we're very grateful. We appreciate the support that all of South Africa is giving to us, from the president to the ministers. We appreciate the fact that people have really responded positively. Even at a personal level, we get messages. People are interested. They ask us questions. They debate issues. They give us suggestions. And I think that makes it easier for us to understand that we are all fighting one battle. And so thank you for asking. We are fine, but I must say South Africans are wonderful people. They've really tried to change their behavior, although you can see it taking a bit of a while. But I wouldn't have imagined that 3 months ago would have said that you can walk around and find everyone wearing a mask. Now you see that. When people are now sensitive about distancing, now you see that. So all of this means if we persist at it, we'll be able to change the behavior of South Africans.